Go.
Hi, my name is Sophia. I'm going to be the student nurse today working with this patient. I'm going to be performing the Foley catheterization skill, but before I go into the patient's room, I need to do hand hygiene. So I want to get some hand sanitizer. Hello, my name is Sophia. Can you first give me your first and last name and date of birth, please? Okay, so today I'm going to be performing a Foley catheterization on you, and it was in the doctor's orders, which I checked with the MAR to make sure it was correct for you, and you're getting it because you're going to be going to a procedure today, so they want to make sure that if you need a void and you're under anesthesia, you're able to do that perfectly. So before I start this procedure, I want to provide patient privacy, so I would close the blinds and then close the door, and then if their bed was too low, I would want to raise it up so I'm not bending down too far and strain my back. So first I'm going to be performing pericare, so I want to tuck back the patient's linens, and then I would ask him or her to make sure they bend their legs so they're that more at an angle. And so I want to get on our gloves for today. And then I would get a water basin with lukewarm water, and then soap and a washcloth. And then we're gonna go over and do our pericare. So I wanna wipe on the outside, get a new clean side, wipe on the other side, and then our last side wiping in the middle. And I would discard this in the dirty linen bin and then throw these gloves away. So we're just gonna put them in our dirty linen corner over here. And then I would do a hand hygiene again and wash my hands. So now that we have the person set up, I got my Foley catheter kit, and now we can open this up and get ready. And so we want to use this as our garbage disposal for any of the excess waste that we make in the process. So we're going to just put this at the end of the patient's bed here. And so now I want to put on my sterile gloves for the procedure. So I would do this off to the side over here. All right, I have my sterile gloves on, and so now we have this peri pad, so we want to put this underneath our patient just in case there's any fluids or vaginal fluids that come out while we're doing the procedure. So we're going to put this underneath our patient before we begin, and we can throw this off to the side so we won't be using this. And so we have our alcohol swabs and our 10 milliliter syringe and our lubricant, so we can put this portion off to the side for right now over here. So we want to set up our alcohol swab, so this will be easier for us when we're doing the washing off the vagina. So we want to get our 3 sticks all situated. And so we can put this at the end over here. And so if we were collecting a urine specimen, we would put it into this container, but if not, we can just put this off to the side. And then we want to make sure we get this plastic wrapping off of our catheter. And we can discard this piece over here. And we want to make sure that this is lubed up and ready to go. And so we can leave it in the packet for right now like this. And then another thing too is we want to attach our 10 milliliter syringe to our catheter before we become unsterile. and then we're gonna leave it in the box. So I'm gonna take my non-dominant hand and hold the labia apart. And so we wanna make sure that we're cleaning this. So we got our outside swab, and then we'll throw it away. And then we have our other side swab, throwing away. And then our last swab, and this will be down the center. And then we can throw this away now. We're not going to use this anymore. So we want to make sure this kit is close to our working reach, and so we can take this tip out of the lube now. And so I want to tell the patient to take in a deep breath because they might feel a little bit of pressure while we insert this. So we're going to insert this tip in. And so you're going to see urine come out from the patient. And if that happens, you want to insert it a couple more inches into the patient. And so I can hold the catheter with my non-dominant hand now and inflate the balloon into the patient. And so now with my non-dominant hand, I can unscrew this and discard this over here. And we want to make sure that that the balloon's inflated, so we'll pull a little bit. And since it's secure, we can take this out of the kit over here, and we would attach like a leg band to the patient, making sure they have enough slack. And we would want to hang this below their bladder onto a non-movable part of their bed. And once we had that all situated, we would make sure we help clean up the rest of our supplies and provide patient privacy and put the linens back over and lower their bed and put their call light next to them.